सो ADR, what is ADR? ADR is adverse drug reaction. So उसकी definition, this is the definition according to WHO, a drug related event. ठीक है, what is ADR? ADR is simple adverse drug reaction. कोई भी हम लोग ड्रग कंज्यूम करते हैं, उसका हम लोगों के हेल्थ पर कोई एडवर्स रिएक्शन होता है जो अनडिजायरेबल हो, अनइंटेंडेड हो, नॉक्शियस हो, उसे ही एडवर्स ड्रग रिएक्शन कहते हैं. सो अ ड्रग रिलेटेड इवेंट दैट इज नॉक्शियस, undesirable or unintended effect and which occur at doses used in humans. Okay, which occurs at doses. For example, I'm consuming this medicine at 100 mg. This is a dose. So if I consume this, adverse drug reactions will occur. Okay, so which occur at doses used in humans for what? For PDT. PDT, prophylaxis, that is before any disease occurs, diagnosis में or treatment of disease. Prophylaxis, diagnosis and treatment of disease, or for modification of physiological functions. So what is the full definition? ADR, a drug related event that is noxious and undesirable or unintended effect and which occur at doses used in humans for prophylaxis, diagnosis, treatment or modification of any physiological function is called as adverse drug reaction. So there are 6 types: type A, type B, type C, type D, type E and type F. A is related augmented. A means augmented, B is bizarre, C is chronic, delayed, end of use and failure of therapy. Repeat once again: A is augmented, B is bizarre, C is chronic, D is delayed, E is end of use and F is failure of therapy or failure of drug therapy. So what is A? Here is a small trick for type A is DPCR. PCR पता है, DPCR. D is it is dose related, P is it is predictable, C is it is common and less serious. Common and less serious, and R is related to pharmacological action of a drug. Okay, so it is DPCR. D is dose related, P is predictable, C is common and less serious, and R is related to pharmacological action of a drug. Now type B is exactly opposite to A, that is it is not dose related, it is not predictable, it is rare, but it is serious. An additional point is due to hypersensitivity or idiosyncrasy. Due to hypersensitivity or idiosyncrasy. Hypersensitivity, that is when a patient consumes, if he has some hypersensitivity, so adverse drug reactions can be seen. So that is type B, that is bizarre, due to hypersensitivity or idiosyncrasy. Then type C, type D, type E and type F. Type C is dose and time related. Type D is time related. Type C is dose and time related. Type D is only time related. Now, type C, dose and time related, occurring in long term therapy. लॉन्ग टर्म थेरेपी से कोई अगर हम लोग ड्रग्स दे रहे हैं उसके वजह से एडवर्स ड्रग रिएक्शंस कैन अकर. So that is called as type C, that is it is related to dose as well as time and occur in long term therapy. Now type D, that is delayed, it is related to time therapy. Delay is related to time. So it is because of prolonged use of any drug or sudden withdrawal of drug. It is a combination of C and E. Okay, it is due to prolonged use of a drug or sudden withdrawal of a drug. That is if a person is consuming a drug for a long period of time और फिर उसे हम लोग बंद करी, sudden withdrawal of the drug. So the reactions which are seen, adverse drug reaction, that comes under E, that is end of the use, that is due to sudden withdrawal of a drug. Okay, E is end of the use, sudden withdrawal of a drug. D is time related prolonged use and also sudden withdrawal of the drug, and C is just occur due to long term therapy. F is unexpected failure of therapy. Okay, let us read the examples. Now in type A, which is predictable and everything, example is hypoglycemia in urine or insulin, sorry, hypoglycemia in insulin. Hypoglycemia, that is glucose level decreases, hypoglycemia in insulin. Second, type B is anaphylaxis with penicillin. Anaphylaxis with penicillin is the example, anaphylaxis with penicillin. Then C, you can see C is corticosteroids. Adrenal suppression with corticosteroids. Type D, D again with C, carcinogenicity. E is like due to sudden withdrawal. So if a person is consuming opioids, so withdrawal symptoms with opioids can be seen. And last is antibiotic resistance. So what is ADR? ADR is any noxious, unintended, unpredictable effect, okay, of a drug and which occurs at some doses in humans. Okay, at which stage? Prophylaxis, diagnosis, treatment or modification related to any physiological functions. We have 4 types: A, B, C, D, E and F. A is augmented, so its dose is predictable. P, dose it occurs, it is related to dose. Okay, it is predictable. C is common but less serious, and R is related to pharmacological action of a drug. B is exactly opposite, not dose related, not predictable, it is rare but serious, and it occurs due to hypersensitivity. C was time and dose related. It was time and dose related, and it occurs, okay, due to long term therapy. It occurs due to long term therapy. D is only time related. It occurs due to prolonged use of a drug or sudden withdrawal of a drug. E was due to sudden withdrawal of the drug, and F was due to unexpected failure of a drug. Example of this was hypoglycemia with insulin. For B, it was anaphylaxis with penicillin. For C, it was adrenal suppression with corticosteroids. For D, it was carcinogenicity. For E, it was withdrawal symptoms with opioids. And last one was antibiotic resistance. So this was ADR.